Right. Good afternoon, everyone. I'm Chris Sorchik, Executive Director with the Capital Area Healthy Start Coalition. Thank you for joining us today for our Lunch and Learn series. We're asking if you aren't speaking to please put yourself on mute. Our Lunch and Learn series was created to address various aspects in maternal and child health. Today, we're going to talk about the importance of good nutrition and on how healthy eating impacts mental health, lactation, and healing. Please join me in welcoming our presenter, Daikebra Gaskin. Ms. Gaskin is an international board-certified lactation consultant and a registered dietitian serving the Tallahassee and surrounding area. She currently works at Tallahassee Memorial Healthcare as a clinical dietitian. She previously served as the director of the WIC and Nutrition Program in the Department of Health in Leon, Wakulla, Franklin, Jefferson, Madison, and Taylor counties, where she worked until April 2022. She currently serves as the president of the Florida Breastfeeding Coalition and is a member of the local Capital Area Breastfeeding Coalition. She is also the co-chair and co-founding member of the Breastfeeding Policy Work Group. Daikebra was an adjunct faculty member at Florida Agriculture and Mechanical University from 2008 to 2013 and taught nutrition to undergraduate students from 2006 to 2007 at FSU. She also works as a nutrition consultant for various research projects being conducted in the Tallahassee area and speaks to local churches about how to implement healthy eating practices into their lifestyle. Daikebra also serves as the preceptor for dietetic interns for the community nutrition portion of the internship rotations at WIC. Daikebra graduated from Florida State University with a bachelor's in human sciences with an emphasis on exercise physiology in 2003 and continued her studies at FSU, earning a master's degree in food and nutrition with an emphasis on clinical nutrition in 2007. She is a registered dietitian with the Commission of Dietetic Registration and a licensed dietitian nutritionist in the state of Florida. She is also a certified breastfeeding specialist and is studying to become an international board certified lactation counselor. Though trained as a nutritionist, her passion is public health and infant and child feeding issues, with a focus on human milk feeding and the promotion of healthy lifestyles in minorities and other underrepresented populations from infancy through adulthood. She has 14 years of experience as a pediatric dietitian and 10 years experience as a breastfeeding counselor. She has been married for 16 years to her college sweetheart, and they are the parents of two beautiful daughters, ages 9 and 5, both breastfed over 3.5 to 4 years each. Daikebra, welcome, and thank you so much for being with us today.
Thank you, Chris. I hope everyone can hear me. Thank you for that warm welcome. So I am honored to be here with you guys today. I am honored to return. We did a preconception health presentation last year for National Nutrition Month, which is celebrated in the month of March. I'm glad to see old friends. My mom and my sister are actually here, so that's really exciting. And I appreciate you guys for taking your time to be with me for your lunchtime. I'm going to go ahead and share my PowerPoint, and we'll get right into it. All right. Okay, so hopefully everyone can see this. We're going to take our questions at the end. I'm going to get right into it. So this is our Lunch and Learn series, and I'm calling it Nutrition in the Fourth Trimester and Beyond. So our objectives today is to define the fourth trimester and the role nutrition plays, key nutrients as well. And we're going to talk about intentionality when it comes to making nutrition-related decisions, nutrition for those who were diagnosed with gestational diabetes, hypertension, or who might have had diabetes before they became pregnant. We'll touch on nutrition and lactation, and I am going to spend some time talking about the type of support that that is needed for those who recently had a baby. I would be remiss not talking about the type of support in the community, because when it comes to addressing nutrition concerns, addressing needs, sometimes you have to get the basic needs addressed, for lack of a better term. You have to get those basic needs addressed and then come with a multi-layered approach. So you may be talking about nutrition, but someone may have some food security issues, or they may have issues with grief or loss or just a shock, or maybe there's something going on with the baby that they didn't know and the baby needs extra care. So we're going to talk a little bit about those resources that are available. All right. So the fourth trimester we define it as the first 3 months or the first 12 weeks after the mother has the baby. Mothers, unfortunately, have the least amount of interaction after they have their baby. During your pregnancy, in comparison, there's so many doctor visits. There's, you meet with the doctor or the midwife once a month, then it's every 2 weeks, and then it's every week after that until the baby is born. So the American College of Obstetricians and Gynecologists are actually making new recommendations about what the postpartum care should look like. So they're recommending that initial interaction with the OB is actually 3 weeks in comparison to the traditional 6 or 8 weeks. So they're recommending 3 weeks after delivery and then continue care as needed within that first 12 weeks. For Medicaid participants here in the state of Florida, unfortunately, there are some limitations. They tend to be seen right at 6 weeks and then 8 weeks, because they're going to lose their Medicaid coverage. So that's something that needs to be addressed when they're thinking about new recommendations for ongoing care. All right. I'm having to kind of move things around so I can see the screen. All right, so again, with ACOG, they're recommending that the postnatal plan actually be discussed during pregnancy. And I think that's a good idea. And it's going to be more preemptive, so you can get the discussion going about expectations, what mom and her family expects the postpartum period to look like, and meet in the middle. The reality is also that only 40% of mothers go to their postpartum visit. So part of these recommendations, they're advocating for more care, more follow-up care, and to be seen a lot sooner. They're also addressing insurance limitations. So a change in reimbursement is being recommended, and that will allow the policies to be more individualized so that each person can have continuity of care. So thinking about that 40% of people who don't attend their postpartum appointment, there are some real important reasons to go. Remember, the fourth trimester is the window into your future health. So at those postpartum appointments, they're going to be doing some chronic disease and medication management. A lot of people may have been hypertensive before their pregnancy, or a new diagnosis of hypertension comes up. So all of those things have to be looked at. Some people have abdominal wounds because of C-sections, or you get a vaginal tear. So they need to look at those stitches. They need to make sure your uterus is going down, a heart, lung, thyroid check. If there's some kind of postpartum depression screen, they usually do that in the postpartum visits to assess risk, to make the appropriate recommendations or referrals. They look at your blood and your iron levels because of the normal blood loss that occurs. And then they try to address any breastfeeding problems or needs that arise. And then very importantly, they do talk about having sex, if there's a partnership there, family planning, birth control, and a very, again, important birth spacing discussion. So another thing, if we're thinking about the maternal mortality crisis we have, especially in the African-American community, you want to know and understand the warning signs of possible complication. If that patient has some fever or chills, a lot of this is actually seen right in the postpartum appointment. That could be a sign of an infection. Heavy, brisk, bright red bleeding could be hemorrhaging, dizziness, shortness of breath, headaches. That could be a blood clot, or what we call a pulmonary embolism, a new and sudden onset of swelling of the feet, the legs, could be a mother going into preeclampsia or eclampsia, or even deep sadness, preoccupied thoughts of harming oneself or the baby. Even if you don't act on these thoughts, just having them is something that needs to be addressed. And all of these are good reasons to call your medical provider or get straight to labor and delivery triage or the emergency room. And remember that in the first year of life, that's when 1/3 of maternal deaths occur after the baby is born. So as you can see, the 4th trimester, there is a lot of adjustment. You have this new baby in the household. The baby is learning about their new parents. The family is learning about their little new human. You have the feeding issues, the sleep and wake patterns. You're trying to figure it out. You're trying to, navigate the new visitors, the family members, advice. And then you have the doctor's appointments. Most doctors like to see the baby after discharge, usually about day 5 to 7 of life. And then there's some continued follow-up there. You have to sort out your insurance, getting insurance for the baby, sorting out your leave policy with your job, your body's changing. If it's not your first baby, now you're adding that new baby to the children. So you have to manage the other kids. And then partners are learning about each other through the lens of them being new parents. Even if you've had a baby before, if this is your first child and then you have a second baby, the dynamic is still going to be different. So partners are still navigating all of this as well. There's just a lot to deal with when you have another baby coming into the house. So let's shift and talk about the key nutrients for the 4th trimester. So there's been this term going around called postpartum depletion or postnatal depletion. And this term was coined by Dr. Oscar Sirolic. He is from Australia. He's a doctor there. And he wrote a book called The Postpartum Depletion Cure. Okay, I heard someone talking. I apologize. So the postpartum depletion or postnatal depletion, this is a syndrome of accumulated issues, including deep fatigue, hypervigilance, and a feeling of being overwhelmed. And I'm sure a lot of people, if you know someone who's had a baby or if you had a baby yourself, you can understand what a lot of this means. We're talking about physiological issues, hormone shifts, disruption or deprivation when it comes to sleep. And then you have psychological, mental, and emotional factors. There's even a little bit of research that support the mom brain as possibly being what we call some of that, that physiological shrinkage of the brain. A lot of these symptoms are definitely related to nutrient deficiencies, which we're going to touch on. A lot of these can be easily addressed through nutrition intervention. And if they're addressed during and immediately after pregnancy, you can see postpartum recovery. Again, it's a new term. There's not a lot of research on the back end as far as overall the grand scheme of postpartum nutrition with depletion. There is a lot of research that talks about nutrient deficiencies and PPD and certain things such as iron deficiency. Okay. Let me make sure. Excuse me. All right. So a quick word on postpartum weight loss. So we want to remember that postpartum nourishment is way more important than postpartum weight loss. We don't want to initiate diet restriction or caloric restriction too soon after you have the baby. This can actually exacerbate adverse postpartum symptoms. Remember, it takes a minimum of 6 months, and as much as 18 months to fully recover from a pregnancy. And so when you see advertisements like this, it may be true. She might have actually lost 40 pounds in 3 weeks. But the reality is a lot of that is driven by genetics. A lot of that is driven by the fact that she might have already been very healthy, exercising regularly prior to having her baby. There's so many things related to this, but you did have an uptick in this, what we call snapback culture. I saw a lot of it online. There was a lot of conversation about it. And I do feel the narrative is changing when it comes to more acceptance of what a mother's body looks like. We don't want to say this isn't real. Some people do lose weight. They get very slim and trim immediately after their pregnancy, and that's okay. But if you don't, that's okay as well. So we just want to have this discussion, because a lot of people, when they know I'm in prenatal and postpartum nutrition and I give advice, that's the first thing they want to talk about. But I always try to direct them to, let's focus on nourishing your body and getting it to a healthy state, then becoming medically cleared by your doctor to start doing exercise. So the first nutrient I'm going to talk about is iron, and it's the most common nutrient deficiency in the world. Pregnant people are very, very vulnerable, in addition to children and the very old, to having iron deficiency anemia. So remember that with the blood loss, which is normal, and then from postpartum bleeding, what we call lochia, repletion of iron stores is very important. So ideally, during pregnancy, that mother would have been consuming enough iron-rich foods. So then when she does experience the normal blood loss of pregnancy, she doesn't have extremely low levels of iron. So those who, and research shows that those with low iron stores at pregnancy and immediately after, they often experience fatigue that is exacerbated beyond the normal postpartum new mother fatigue, altered cognition, and depressive symptoms. Mothers with postpartum iron deficiency anemia are more likely to have lower health-related quality of life and more likely to have negative feelings toward their baby. What does that really look like? Most people who have a baby, they love their baby. But sometimes if you're tired and you're iron deficient, you have altered cognition, so you're really not thinking right. What that also looks like sometimes, and we've seen it as WIC, is sometimes moms come in and they're having breastfeeding difficulty, and then you come to find out that they're really not picking up their baby as much as they should be to feed their baby. So if they're not feeding the baby and nursing frequently, that would cause some types of breastfeeding complication. You may have some engorgement, but we learned that mom is not removing milk, and we try to find the reasons why. Why are you not picking up your baby? So altered cognition could be one of many reasons. And sometimes there's research that talks about babies who don't get that bond, that initial bond with their mother. There's some other things that can go on with their brain and their growth development, so that can affect their baby behavior. Long-term, we know that anemia and iron deficiency can also affect your reproductive cycle. So especially if conception of that next baby occurs within 18 months. And working at WIC, we see it all the time. We would see moms who'd have their baby in the month of March, and by September, they're several months pregnant with another baby. So you haven't had a chance to have that complete postpartum recovery. And that's one of the reasons I like WIC, is because checking iron and checking blood is a routine process in that program. So the World Health Organization recommends somewhere between 10 and 30 milligrams of iron every day. It's going to be different for each person, but nursing women, I do want to let you know that the risk of iron deficiency anemia is slightly lower, because for many breastfeeding women, they actually don't have an immediate return of their regular menstrual cycle. And it doesn't mean there's something wrong. This is just a natural byproduct of the lactation process. So if you don't have regular bleeding every month, you don't have as much blood loss as someone who is, who's not breastfeeding or who didn't have an immediate return of menses. So she's actually restoring her iron stores, and her route to postpartum recovery is a lot faster. So it's just something to keep in mind. The reality is too, I want to share that a lot of people say, well, if you breastfeed, you're not going to see your cycle, you're not going to get pregnant. We try to discourage that talk in breastfeeding spaces that you can rely on breastfeeding and not seeing a regular period as a sure sign of birth control. It's not 100% complete. So keep that in mind as well. So where do we get iron in our diet? The easiest way to get iron, the most absorbable iron, is going to be found in meat products. So we're talking about liver, beef, chicken, fish, seafood, eggs, and then in our plant sources, what we call a non-heme iron source is going to be our deep dark green vegetables, beans, legumes. A lot of cereals are enriched with iron. One thing you need to remember about plant-based sources of iron, they're not absorbed as readily as it is from meat. So if you have something with vitamin C at that meal, you will have better absorption of the iron. And then for everyone, when you have a baby, we do recommend a daily multivitamin with iron, but you want to talk to your doctor about what's appropriate for you. And that's why the postpartum care has to be very, very individualized. So let's talk a little bit about zinc. Zinc is not something that people automatically go to as far as what nutrients are important for someone who just had a baby. However, the research actually shows that zinc deficiency is associated with postpartum depression. There's a lot of research on that. Adequate zinc stores during pregnancy and with supplementation after pregnancy is actually associated with a lower risk of PPD. It's also an important part of breast milk. It supports infant growth, cognitive development of that baby, and that baby's immune function. So it's also important for wound healing, especially so if you've had a C-section or you had a vaginal tear, that will help support that wound healing. It's also involved with immune function. We know that those who have depleted stores of zinc are at an increased risk of infection, such as cold, minor viruses, and things like that. And surprisingly, I learned that it's also a menstrual cycle regulator as well. It actually supports healthy ovarian follicular cycle to promote ovulation. So for those who have a baby and they want to have another baby, having adequate supplies of stores of zinc can get that process going. And where do we find zinc? We find it in meat again, fish, seafood, and eggs. And then our plant-based sources are going to be beans, nuts, and whole grains. I always say that people who have a vegetarian style of eating, especially if you're the type of vegetarian that does not include eggs, or if you're completely vegan, you want to take a multivitamin with zinc. There's just not enough of what we call bioavailability from the plant-based sources compared to the meat sources. So with protein we know is based on amino acids. It provides essential amino acids to the diet. It supports wound healing, not surprisingly. It helps to repair, rebuild, and maintain lean tissue in the postpartum recovery stage. So we also know that breastfeeding moms, they do need a little bit more protein during the lactation stage. They use protein to make milk from a biological standpoint, so it makes sense that they need more to support lactation, especially if they're exclusively nursing. When cleared for exercise, you can and should have protein as part of a healthy diet. Protein, when we're talking about just weight loss alone, it actually helps to reduce your hunger craving between meals. For those who are diabetic, we actually encourage them to consume protein so they don't have spikes in their blood sugar versus snacking on junk food or refined carbohydrates. And it actually promotes, research shows that, if you're consuming enough protein, it promotes a healthier weight loss pattern for those who want to see themselves get back to their pre-pregnancy weight. You want to aim for 4 to 5 servings a day. And I did want to add, because I get this question all the time, you don't want to do very low carb, high fat diets like keto, very low carb. I think they have the Atkins out there. You want to talk to your doctor about the appropriateness of this. It's not appropriate for everybody. And I mentioned keto because keto is a high protein and a high fat diet. A lot of mothers do develop new medical conditions like chronic kidney issues, congestive heart, and diabetes. So altering how much carbs, fat, and again, protein can be very, very dangerous, okay? Where do we get protein? We know that it's going to be meat. Plant-based proteins are going to be beans and rice. Not surprisingly, protein is where you're going to find a lot of your iron. Some foods have calcium, but magnesium, B12, vitamin D, and what we call healthy fats. Healthy fats, these are the ones that don't increase your blood levels of cholesterol and your good and bad cholesterol. You always want to include both meat-based if you eat meat, but plant-based proteins as well. I always tell people if you don't eat meat or you're not in the mood to eat meat, you can always do beans and rice to make a complete protein. So beans and rice together will have the same amino acid pattern as meat. You want to choose lean cuts of meat. Okay, you always want to do baked and grilled over fried meats, and of course, air fryer is okay. So moving over to calcium, this nutrient is near and dear to my heart. I'm always talking about it. I did research on it when I was in school. So we know that the importance of calcium in pregnancy is to develop the baby's bone as they're developing in the womb. And if calcium is inadequate during pregnancy, what the body will do is it'll slowly break down mom's bones during the pregnancy to meet the fetus's needs. If she's not consuming enough, that will increase her bone loss and reduce her bone recovery postpartum. Okay, and most moms when they are pregnant, there's going to be a little bit of bone loss for everybody, even if you're a big calcium consumer. The key is, after you have that baby, how well are you getting back to, are you building that bone or recovering that bone? That's really the key here. So you want to consume enough calcium during your pregnancy and after your pregnancy. You want to, and this will help reduce the loss of bone in the premenopausal years. So this is something we're looking at. When we had the preconception health discussion, I talked a lot about calcium, which works with vitamin D. And I talked about how when I was at WIC, a lot of people did brag about, I don't drink milk. I don't like milk. It's just something I never drank growing up. And I always say, how are you getting calcium in your diet? And of course, they don't really have an answer for it. So it's something that I feel is very important. And now that I'm working in a hospital setting, I ironically am responsible for the orthopedic floor, which is all bone breaks and things like that. And most of the people who have slips and falls and they easily break their bones, they have osteoporosis. And when I do my nutritional assessment, sure enough, they were never milk drinkers or they're not taking any supplements, and you go 50, 60 years like that. And then you have children, 1, 2, 3 children or more. And so you have that continued bone loss over time. Once you hit postmenopausal age, you don't build bone like you used to in your youth. So all of these things can contribute to osteoporosis. It makes it easier for you, if you bump into a wall or if you just slip and fall, you have what we call a complete break. And so all of that increases your risk factors for chronic disease. I actually, when I leave here, I have to actually do a consult with a patient who broke her leg, and they want me to talk to her about calcium and vitamin D. So it's kind of interesting for me. It's kind of full circle because I work with new moms and babies talking about calcium. Now I'm actually working with older people talking about the importance of calcium, but unfortunately we're kind of on the back end. So a lot of the recovery to improve calcium is going to be highly therapeutic, lots of medications to do it. So the key here is to pay attention to it while you're premenopausal and or if you're talking to other people who are pregnant, they're not milk drinkers, definitely try to get them to think about their calcium intake. So for pregnant and breastfeeding women, general recommendation is about 1,000 milligrams of calcium a day. If you drink cow's milk, that's just 3 glasses of milk. You can get that from a daily multivitamin supplement or a standalone supplement. talk to your doctor. There may be some specific supplements with calcium and vitamin D you may have to be prescribed. And these tend to be pretty reasonably priced. So a word on calcium and teeth sensitivity, because we get this all the time. I've had young women tell me, I broke my arm during my pregnancy, or, I lost a tooth, or my teeth feel very sensitive, since I've been pregnant, or ever since I started having children, and it never got better. So number one, you want to talk to your dentist, get regular dental care. That is so important. Also, what happens with pregnancy, calcium and vitamin D deficiency, it's not that the tooth itself is being broken down. Remember, it's your bone that supports the teeth, the bone of your mandibles. So that is what tends to get worn down during pregnancy. So that causes, you don't have that support. So that causes the teeth to become loose. Also, you have to think about tooth decay in pregnancy. A lot of that can occur for some people, and is most likely due to already underlying teeth problems before you even got pregnant. It's not necessarily what people say is the baby draining mom. So, a lot of people when they're pregnant, they're drinking more sodas. So that's something to consider, or they're drinking more juice. Some people have nausea for more than just their first trimester. So they may be drinking a lot of ginger ale or other sodas or other juices, drinking a lot of fluids because they can't tolerate food. That is a point to discuss good dental care. A lot of people are snacking on more carbohydrate or sugary foods like snacks and candy and ice cream. But if they have nausea, they're not brushing their teeth. I remember being, I had to switch my toothpaste when I was pregnant because my nausea and how I tasted foods was, it was very different. So I changed my toothpaste. And so I can imagine someone who doesn't naturally think about that, they may slow down on how much brushing they do. And then also you have to think about frequent vomiting. If you're vomiting a lot, you can have stomach acid that's wearing down on your teeth. So you have that going on, and then you have low calcium and vitamin D intake. And so all of this is making a bad situation worse. And again, losing teeth is very real. It happens during pregnancy. It happens people complain about losing their teeth right after pregnancy. So also in breastfeeding women, bone losses that occur during lactation actually stop once the baby is weaned. Bone loss recovery occurs immediately, especially if mom is consuming foods that are high in calcium and vitamin D on a regular basis. So more about vitamin D. Remember, calcium and vitamin D work together. And vitamin D is really a miracle nutrient. It wears so many hats. It acts like a hormone. It's an endocrine regulator. It's involved with immunity. And then of course, calcium and bone metabolism. And vitamin D content of human milk, this is associated with the mother's vitamin D levels. So right now, general recommendations is to give exclusively breastfed babies who don't get any infant formula. They should be given 400 international units of vitamin D every day within the first few days of birth, as early as day 3. Or if the baby won't take the vitamin D drop, I know my second baby would not take any drops. The lactating mother can then take about 6,400 international units of vitamin D3 every day to meet her and her baby's requirements. Okay, and that can be prescribed by the doctor. I'm not sure if you can get that high of a dose over the counter, but those can be prescribed by the doctor for mom, and those are just they're not even like $5. I've seen 50,000 units of vitamin D. You can get that for about $4 or $5 from the pharmacy. Long-term, we know that deficiency is also associated with chronic disease risk. Research shows that people who have chronic diseases such as diabetes, if they have heart conditions, hypertension, coronary artery disease, they tend to have very low vitamin D levels. We haven't found like a direct cause and effect. We just know there's an association. So this is even more important while you're in your childbearing years, even after you have your baby, to make sure you're getting vitamin D. Okay, and of course we have osteoporosis, which we touched on earlier, when you're postmenopausal. Where do we get calcium in our diet? I mentioned milk all the time. I was a milk drinker growing up. As I got older, I did become a little bit sensitive to the lactose in milk, so I drink lactose-free milk. I still don't drink a lot of milk, so I pretty much take a supplement that my doctor recommended, and I'm taking a vitamin D supplement that I was prescribed. Other things you can do is you can do alternatives to milk, like plant-based milk, oat milk, almond milk. Just know that the plant-based milks don't have a lot of protein in them. So it wouldn't be a great source to depend on protein if you need it. You'll have to get that from other parts of your diet. A lot of people give their children plant-based milks, which is perfectly fine. They just have to make sure that their children are getting protein from other parts of their diet. Dark green leafy vegetables like spinach and kale, you want to include that regularly. The only thing about dark green leafy vegetables, there's some people who are on blood thinners, they cannot and should not be eating a lot of dark green leafy vegetables. And that's because the vitamin K in these foods can cause the warfarin and the Coumadin, which are the blood thinners, to not work. Okay, so that's just a little thing to put aside. But for everyone else who are not on blood thinners, they can do their dark green leafy vegetables, and they should. White beans, sardines, certain types of fish, herring, those are good sources of calcium and vitamin D. Fortified orange juice. Orange juice is not a natural source of calcium, but you can find it on the market. It'll be labeled as such. And then you have fortified cereals. I just want to remind you with fish, especially in lactating women, especially in pregnant women, fish does have mercury. So as long as you're not eating large species of fish, such as shark or swordfish, regular fish should be okay with mercury. You just don't want to do more than twice a week. And then, of course, I'm old school. My mom's on this call, so she used to give us cod liver oil, like a teaspoon or a tablespoon of cod liver oil. And so I remember when we didn't like taking it, but we would take it. I think we were probably teenagers when she stopped giving it to us, and then it kind of went out of style. But then you started getting the fish oil pills, and then now I'm seeing cod liver oil on the market again. So what's old is new again. All right, so moving over to folic acid, and we always talk about folic acid in the context of preventing neurotube defects when you're preparing to have a baby, but it's also important to have folic acid after you have a baby as part of a healthy diet. Folic acid is also another nutrient that plays many roles. It's important for brain function, mental and emotional health. It actually aids in the production of DNA and RNA, which is genetic material, okay? Also, when you're thinking about processes such as rapidly growing cells, we're talking about fetal development, pregnancy, and then adolescent growth, it is very important to make sure during these processes that there's enough folic acid in the blood. So again, with pregnancy, you need folic acid to prevent any kind of deleterious effect with development. So thinking about spina bifida, thinking about anencephaly, but also we want to make sure that mom is getting enough folic acid in her diet after she has the baby. So it's another reason birth spacing and being intentional about when you're conceiving your baby. For those who really, really want to have their babies close together, you want to make sure that there's enough folic acid in the blood so that if you conceive again within 18 months, that next baby is not at a higher risk of a neurotube defect. Breastfeeding moms need to definitely consume folic acid. Again, an exclusively breastfed baby, human milk is their only form of food. So you want to make sure that that baby's getting enough folic acid, getting enough breast milk in their diet. There's no research saying that you need to give a newborn baby a multivitamin to get the folic acid. Folic acid is associated with a different type of anemia called megaloblastic anemia. So microcytic anemia or iron deficiency anemia, it makes the red blood cells kind of small and pale looking. But with megaloblastic anemia, the red blood cells actually look very big. So it's a very, very specific type of anemia that doctors can identify. Symptoms of folic acid deficiency is important to identify. We do this in a clinical setting, and then you can sometimes see this if you have a pregnant woman who's hospitalized for malnutrition or something happened. Pale skin, decreased appetite, being irritable, grouchy, a lack of energy. And then we do a clinical assessment. So sometimes looking at how their tongue is, we can tell that there's some kind of micronutrient deficiency. Also, I tie everything to pregnancy and in our discussion. So a word on alcohol abuse. We do see people who come into the hospital because they have some alcohol intoxication, and we actually give them folic acid and thiamine immediately because it actually causes our body to not be able to absorb folic acid. So the blood levels are going to be low. I always talk about alcohol in context of pregnancy because for people who do binge drink regularly, what happens sometimes is you can conceive a baby. Okay, sometimes partners are drinking in excess and they conceive a baby. So, and then remember, in the first part of my lecture last year, we talked about preconception health. If you're drinking in excess, you don't really know that you're actually pregnant until you're already 4 weeks along. So we talked about critical periods. So if you're drinking in excess, then you find out when you're about 4 or 6 weeks pregnant that you're pregnant, you have missed a lot of critical periods. So that's why intentionality, even with drinking, you have to be really careful because if you're drinking, you're not absorbing that needed folic acid for that baby to develop properly. So I don't want to sound morbid, but this is it just highlights the importance of folic acid. So I always draw a line to make it relevant to our discussion. Where do we get folic acid in our diet? Again, it's a pattern: dark green leafy vegetables, citrus fruits, 100% orange juice, strawberries. Believe it or not, people who eat liver will find folic acid there. And then you have your plant-based sources, your other plant-based sources like beans, peas, lentils, legumes. Poultry has a little bit, whole grains. And since 1998, we've been fortifying all of our whole grain products, our flour with folic acid. And we did see a marked decrease in the incidence of neurotube defects, specifically spina bifida and encephaly. Okay. And so of course, everyone of childbearing age should be taking a multivitamin with at least 400 micrograms of folic acid. Some people need to take 800 to 1,000 micrograms of folic acid. That has a little bit to do with prior miscarriages. However, that has to be prescribed by the doctor. Okay. So people always say, well, I've had my baby. Do I still need to take multivitamins or folic acid? And I say, yeah, as long as you're childbearing age, you should be taking folic acid supplements. And then, of course, I always like to talk about water. This relates to our discussion because hydration is important. I also like to talk about it in context of when you're thinking about fluids. People still like to drink a lot of sugary beverages. So if you want to get back to your pre-pregnancy weight, a healthy way to do that is to not drink your calories. Pregnant women are losing fluid, a lot of fluid every day. Sometimes it's as much as 600 or 700 mils of fluid every day just because of how much their babies are drinking. So they need to replace at least half of that when they're consuming fluids. And then of course your fluid should be mostly water. So the grand scheme of things, when you're thinking about what you should be eating after you have your baby, you want to definitely avoid excessive sodium intake. Remember, water follows salt. So foods that have a lot of sodium, foods that have a lot of sugar, processed food, fried foods, you want to limit that. Specifically for soda, coffee, and caffeine in excess, you really need to talk to your doctor. I've talked to different doctors and I kind of get different results. Some of them say you should absolutely have no caffeine, even if you're healthy with no other pre-existing conditions. And some say, well, you can do a little bit of caffeine. So it's good to talk to your doctor to see what's appropriate for you. But for the general population, after you have a baby, you want to do a lot of this, you want to do this minimally. What should you include? Well, we already talked about proteins. So proteins, fruits and vegetables. The vegetables we want to focus on are dark green leafy vegetables, orange vegetables, which are all rich in micronutrients, including the ones we've discussed already, nutrient dense foods. And I highlight that because you want to get more bang for your buck. You're a busy parent and you're not going to be able to eat, 6, 7, 8 times a day. It's incredibly difficult to do that. So if you're only able to, put food in your mouth 2, 3, or 4 times a day, you want nutrient dense foods. So eggs, avocado, lean meat, lean dairy, seafood is fine, seafood specifically low in mercury, and then of course a variety of whole grains. And I talked a little bit already about plant-based milks being low in protein, so you have to look at other parts of your diet. I wanted to include healthy snacks. Sometimes when you're trying to figure out what should I stock up on, what should I be eating, you want to try to eat 3 times a day. It doesn't have to be, 8 o'clock in the morning. Breakfast could be 10 o'clock for some people. That's totally fine. So you want to have an early morning snack or breakfast. It could be yogurt, a granola bar. For lunch and dinner, you always want to kind of break that up into like a meat, a starch, and then a vegetable and or fruits. Honorable mention for breakfast, I like to say cereal with milk. Hopefully you're choosing a healthy cereal, or again, the oatmeal, overnight oats. For lunch or dinner, I'm a big believer in what's easy and convenient, but make it healthy. So a sandwich is absolutely appropriate. You just want to make sure if you're doing PB&J, have some fruit with it. If you're doing, like grilled cheese sandwich or something like that, do a healthier cheese, you do whole grain bread and have some fruit with that. And then of course, a meal replacement shake is appropriate if you just cannot eat enough food. I know for myself with my second child, I actually had nausea majority of the pregnancy, and then I had nausea for the first week that she was born. So I actually was doing sandwiches and I was doing some of these meal replacement shakes, and that's what I needed to get through. This is just a couple of other ideas for snacks. If you have any questions, you can always reach out to me. But the key is we want to encourage our families to make sure they're eating. Okay, more on snacks. I'm a snacker person. Okay. All right, so just a little bit about postpartum nutrition for those with pregnancy-related conditions. We do see a lot of gestational diabetes and prediabetes. So if you are diagnosed with gestational diabetes, you actually have a higher risk of becoming a diabetic. Even if before you were pregnant, you had no other medical conditions, you were not pre-diabetic, but once you're diagnosed with it, you have a higher risk of developing diabetes. It doesn't mean that you will be, the risk is just higher. So for a lot of people, once they literally the minute they have the baby, they get their blood sugar checked, and it's as if they were never diabetic, and it technically, for all intents and purposes, goes away. So you want to continue monitoring your blood sugar levels. A lot of pregnant people who are diagnosed with GDM, they are given monitors, and I say keep checking your blood sugars. Okay, if you were prescribed a carb counting regimen, you really should continue doing that. But get to your doctor as soon as possible, because you may not have to do that after you have your baby, or get that advice at discharge from the hospital. Definitely keep your postpartum appointment, schedule that immediately, ideally within the first month, instead of waiting all the way till 6 weeks. I know I put 2 to 6 weeks here, but I think really 4 weeks is probably ideal, and then follow up again. Once you are cleared for exercise and being able to move around, go ahead and start with, maybe 10 or 15 minutes a day, just to help get your body to respond to insulin appropriately. Exercise is really good for people who have blood sugar fluctuation issues. If you're breastfeeding, we all know that you should be eating more calories. There's no medical reason that a person who had gestational diabetes or who is a diabetic, there's no reason they can't breastfeed. And research actually shows that they have a little bit better of blood sugar regulation with the breastfeeding. You still want to eat foods that are higher in protein, lower in refined carbs, and you want to avoid drinking your calories. And then if you have preeclampsia or issues with hypertension, eat a healthy diet, limit sodium. We don't talk a lot about sodium in younger populations, but you really want to limit sodium. I would definitely avoid or limit caffeine until you were cleared by the doctor, and continue to monitor your blood pressure, schedule your postpartum appointment, and then watch for those warning signs we discussed in the earlier slides. And then I've already talked about this a little bit. This is one of my favorite celebrities. She just had, her baby's about, 7 or 8 now, but she had just had this little guy. And as you can see, she's still getting a meal. So you want to make sure by any means necessary, do what you can to get those extra calories so that you can maintain lactation. And I always tell people, pumping is nursing too. You're burning about 100 calories per session of nursing or pumping. And then make sure you're taking a multivitamin, make sure you're eating regularly. But nursing moms do need about 300 to 500 extra calories a day. So rally support to improve your nutrition goals. For people who say, what can I do to help my friend who just had a baby? Get her a Uber Eats card, help her order some meals. They have the meal train. You can make her a delicious entree. You can help her with sandwiches. You guys can rally together and help her do a little bit of meal prep. Anything you can do to help her meet her nutrition goals. I always tell people to delegate and get the help that you need. Advocate for yourself. And then I like this one. It says, sorry, baby, for all of the food I dropped on you while nursing. And I definitely, dropped some crumbs on my little one while I was nursing, while I was trying to eat. So again, being intentional, keeping nutrition to the forefront as far as your postpartum plan, and then definitely make sure you hydrate. All right, and we're kind of running out of time, so I'm gonna move through these kind of quickly. But again, we have to address certain social issues because it's really hard to give nutrition advice if people have some food security issues, for example, or other things and are needing help. So research shows that social support is actually really key into reducing postpartum depression risk. So families, couples should be identifying their allies to get the kind of help that they need. Family dynamics and expectations are different depending on the culture, generation to generation. So having a listening ear, and again, knowing the resources available can help you in the postpartum recovery stage. So I talked a little bit about the WIC program. They do nutritious food, nutrition monitoring, breastfeeding support, the SNAP program, which is the food stamp program, food pantries, just being able to point people to those resources if they're in need. It would make it easier for them to then formulate a plan and have a little bit more intentionality if they don't have to worry about basic necessities for their household. Additional support, again, I'm always talking about WIC. That's my heart, that's my home. They're always going to be just part of how I approach pregnancy and lactation, because that was kind of like formal informative education for me. So I always turn to WIC when I know people may be income eligible or Medicaid eligible for WIC. I'm always referring them. For those who don't know, WIC actually, I know WIC in Florida does, if you have a miscarriage and it's within the first 6 months and you're eligible, you actually would be eligible for WIC benefits and to roll in WIC. And remember, we talked about those closely spaced pregnancies. I know for a fact that some doctors will say, hey, I understand you had this miscarriage, everything else is okay. You actually are clear to conceive, give yourself 2 to 3 months. That's technically a close pregnancy. So we want to have some nutritional support, again, to help if they have if they go full term, we want to make sure that they have that nutritional support to go on and have a healthy pregnancy. And then, of course, our gracious host, the Capital Area Healthy Start Coalition. If you haven't been on their website, please explore their website. They have so many great programs. It was started by Lawton Childs. They've done just amazing things when it comes to support, helping people who have postpartum. We're talking about the home visiting, the prenatal education, the breastfeeding education, and they're doing some really, really awesome new things in the community with the doula programs. They have a sister-to-sister peer support. They have the father initiative coming up. So this is really, really, really a good program to refer people to get the support that they need. Sometimes when you plan for a baby, sometimes you don't go full term. You have this baby and they decide, like mine did, to show themselves very early. So these are some programs that can help reduce the anxiety that parents may have about what's going on with their baby. NICU support, PICU support. These are really, really good programs. I know the March of Dimes helped us with eating and traveling and stuff like that. So that actually reduced a lot of anxiety I would have had as a mom. Those are just some things I didn't have to worry about, and I can focus on my health and my baby and breastfeeding. Melanin Mothers Meet targets African-American women to help reduce maternal and infant mortality in the African-American community in Tallahassee. They do spiritual care, they do blessing ways, they help with food. There's so many professionals there, doulas, birth workers, lactation professionals. So it's a really, really good group if you know someone who is in this population who could need some help. We have our Breastfeeding Coalition. I'm part of the state coalition. We have private practices. We actually have another not-for-profit called MAPS. She helps with breastfeeding education. She has classes, virtual support. The National Alliance on Mental Health has the Circle of Support program for those who definitely are at a high risk of PPD or they've been screened. And then you have grief counseling because it happens, infant loss, maternal loss. So again, you want to address ways to decrease the anxiety to make sure basic needs are met so that people can then formulate a plan and think about their nutritional needs. So the fourth trimester, that's me and my little one, me having the longest fourth trimester ever. She's 5 months here and she didn't leave the NICU until she was 7 months old. So that was, I kind of started my, postpartum part when she was 7 months old. So that part is going to look different for people. So we want to be aware of that. And then I always tell people to make sure you enjoy your baby. Okay, so this is my second one. I'm trying to put her down. She's 6 days old. And I really, really thought she was ready to go to bed, but no. All right. So I have my bibliography here. If you have any questions, I know we're very, very close on time, but I thank you guys for all of your support. Thank you so much.
Wonderful. Thank you so much, Daikebra. Does anybody have any questions? You can either raise your hand or go ahead and come off mute.
I forgot to mention, I said we had some private practices. I've started a private practice and I see my buddy, Sarah is here. She does private practice lactation. So what a good group. I'm so glad to see everybody here. Thank you.
Any questions? Lots of thank yous in the chat, Daikebra.
Yes, and I see Dr. B is here, and I have so many pictures to share, but I definitely encourage if you have active partners. My husband was definitely some good support. He knew nutrition was a big deal for me. He knows I get hangry, so he would be the one bringing me food and bringing me things that I need. So sometimes people say, I don't know what to tell my partner to do. A glass of water, bring me a plate of fruit or something. So those partners and those fathers, and that's why I'm glad, Chris, that you guys are doing the fatherhood initiative. It's really, really critical.
Absolutely. We're very excited about that. Our fatherhood program is hosting a Dads and Strollers on March the 18th at Cascades Park. So hopefully we'll see some of you there. If there are no questions for Daikebra, I want to just take a minute. Again, thank you so much, Daikebra. I always learn so much from you.
Thank you.
So I appreciate you. Our next Lunch and Learn is going to be on April the 7th at 12 p.m. We have Tiffany Austin, who is going to talk with us about the midwifery model of care. So very excited about that. We hope you can join us. I hope you all have a fabulous weekend. Thank you for coming and joining us this afternoon.